our big message at this point is to say, don't close your clinic. And I wouldn't even discuss that being the way you relate it to patients unless you're ill as a provider yourself. Let's switch to telerheumatology. Let's adopt that and take that on, because that way we can stay connected to our patients. We don't give them the impression that we've abandoned them, and we don't turn them loose to be wandering through primary care, urgent care, or emergency departments where their risk of infection is even higher. And unfortunately, that subspecialty knowledge that we have just isn't available. So we shouldn't be thinking about stay open or closed. We should be thinking about continuing to see patients in person and doing everything we can to protect our patients, ourselves, and our staff if we do that, or transitioning to a telerheumatology practice, that allows us to continue to be connected and to continue to support our patients appropriately. And by the way, it's not an either or, in that there are hybrids that are very effective as well. And we're providing resources and opportunities for those rheumatologists out there who have never, ever done a telerheumatology visit and have no capability to do so. We're going to provide resources that allow them to rapidly ramp that capability up and provide that for patients. You can now do a telerheumatology visit over your smartphone, and that's been approved according to the new regulations. So that's all you need now. Mm-hmm. If you don't have a smartphone, you can have a telephone visit, and there are codes that your doctor can use to bill for a phone-only visit. So this is the point, that if a rheumatologist decides it's too dangerous to have face-to-face visits, if they tell patients that their office is closed, oftentimes the patient doesn't realize that you as a rheumatologist may just be a phone call away from continuing to support them, take care of them, and treat them. It's a different interaction. It's uncomfortable for everyone involved initially, but it's really important to understand that that's a better scenario than if you tell a patient that your office is closed. That may mean a lot of things. That may mean we're no longer seeing patients and having contact with patients in any way, or that may be that we're no longer doing in-person visits, or it may be that aspects of ancillary services that we usually provide aren't available, or it may be that you're only doing telerheumatology. But regardless, saying that you're closed can be very misleading and anxiety provoking for patients. And so I would encourage getting rid of that verbiage and instead talking about whether you're doing telerheumatology with video capability, or telerheumatology via phone call, or whether you have limited services available, or whether you're open with screening. So I think the most wide open approach would be to warn patients ahead of time that you're doing, if you're still doing in-person visits, tell them that you're going to have some screening procedures for their safety, wherein before they're given admittance to the clinic, that they're going to be evaluated differently than what they're used to. This can allay some concerns, because if a patient shows up not knowing that they're going to go through that, they may think that something concerning is happening. And warning them ahead of time, I think, is very reassuring as well.